Duchenne muscular dystrophy is caused by a genetic mutation in the dystrophin gene that causes the loss of the dystrophin protein. The dystrophin protein, which is usually localized to the sarcolemma membrane, connects the extracellular matrix to the intracellular region. Without dystrophin, the membrane is very susceptible to contraction-induced injury, causing lesions to the membrane and a very deteriorating progression of the disease. This causes all muscles in boys with DMD to be very weak, including heart and breathing muscles, which ultimately becomes life-threatening as the disease progresses. DMD affects all aspects of life, including one that usually doesn't come to mind: sleep. Sleep problems in normal individuals are not uncommon. However, sleep problems are further exaggerated in individuals with DMD. The earliest signs of respiratory failure in DMD patients are generally detected during sleep. Respiratory muscle weakness increases the risk of sleep-related breathing disorders, including obstructive sleep apnea and alveolar hypoventilation. Obstructive sleep apnea is caused by partial or complete obstructions of the airway and characterized by periods of difficulty breathing. Common symptoms include daytime sleepiness and restless sleep. Alveolar hypoventilation is when the individual does not take enough breaths per minute, causing an increase in the partial pressure of carbon dioxide in the body. Studies have also shown that patients with DMD awake frequently at night, causing sleep fragmentation, which has detrimental short and long-term health effects. Short-term effects include emotional distress, memory and performance deficits, and cognitive dysfunction. Long-term effects include hypertension, cardiovascular disease, weight-related issues, and type 2 diabetes. But the most obvious consequence of sleep deprivation is daytime sleepiness. Sleep is generally characterized by two stages: rapid eye movement, or REM sleep, and non-REM sleep. Non-REM sleep is further broken down into stage 1, stage 2, and slow wave sleep. Research has found that REM sleep, which is important in development, learning, and memory consolidation as a proportion of total sleep, is significantly reduced in individuals with DMD, indicating that the sleep changes that DMD patients experience can be detrimental to learning and memory. It was also found that stage 1 sleep was increased compared to normal values, indicating that their overall sleep efficacy decreases. DMD patients experience an overall decreased quality of sleep that affects their overall quality of life. Current researchers on DMD and sleep are striving to find treatments to improve their quality of sleep and life.